TZVECL.
Excellent. You're 2020.
All right. How about that? It's that easy. We were down at Henderson Vision Center with Dr. Irene Mestito-Dao talking about the importance of regular eye exams. May is Vision Health Month across Canada. How important is it?
Oh, it's very important. I mean, that's why the theme of the month is to get your eyes examined. 2020 vision does not mean that you actually have healthy eyes. It means you don't need glasses, but it doesn't necessarily mean that you have healthy eyes, because 75% of Canadians are going to have a serious eye disease at some point in their life, and the symptoms, they're not even going to realize they have it most times.
What are some of the most common eye diseases that we would see?
In Manitoba, the most common is cataracts.
Okay.
And then it's followed by age-related macular degeneration, or more commonly known as AMD. Then diabetic retinopathy, because there's a lot of diabetics, and glaucoma.
So regular eye exams can help be preventative, though?
Definitely, yeah. That's early prevention. CNIB, that's their motto. They want to try to prevent people from having to deal with serious eye diseases. And it is quite simply, in early stages, there's so many things that can be done. By the time they lose their vision, the chances of getting their vision back, like even if we can do surgeries and medication and things, that it's just not as good a prospect.
Yikes. Yeah. Okay, so it is important to start really young, especially even with infants.
Yes, definitely with infants, yes.
So what would the age to take a baby be to have their eyes checked?
Well, eyes aren't fully developed till they're 6 months. So
okay.
6 to 9 months is recommended if we're going to test the infants. Pediatricians usually are watching them at that point, and they'll send them in. If there's any doubt, that's what I tell parents, is to bring them in at 6 to 9 months.
And what about kids?
Kids, we start as early, we can start at any point, but it is recommended by the CAO to be tested between 2 to 5 years, so
okay.
by 3 years old to be tested, and for sure before school.
And then how often should kids be tested?
Again, recommended is yearly, but Manitoba Health covers every 2 years. Unless they wear glasses or there is a visual concern, they will cover them yearly.
And what about adults? Every 2 years?
Every 2 years for adults, yes.
Okay.
Unless they have unless they're diabetics, or if there is a eye concern that needs them to come in yearly. If there's a significant family history of glaucoma or diabetes, macular degeneration.
And as you get older, seniors?
Seniors, again, every 2 years is what's covered by Manitoba Health, but yearly, if there is any concerns, is covered by Manitoba Health as well. And we would recommend seniors, most seniors need to be done yearly.
Well, it is important because, like you said, there's no symptoms attached to a lot of the eye diseases.
Exactly, yes. And so by the time that they know it, as I said, if they come in because their vision is blurry, that doesn't really mean, it's not just glasses. That's what
right.
people think. People think that, oh, I'll know. When I can't see, I'll know.
Well, it's a perfect time to go get an eye exam. It's quick, it's easy. It is Vision Health Month across Canada. For all the information, we have our links up on breakfasttelevision.ca.